My name is Jesse Martin. I'm the Executive Vice President for 1199 New England. Okay? We represent over 5,000 healthcare workers in the complete continuum of care across the state. From when people come into the world at Women and Infants Hospital, to Butler Hospital when people are dealing with the worst moments of their life to get help, to federally qualified clinics where people get their primary care, to nursing homes, to home care, and to social services that support the poor and the working class across the state. Now, we're here today because today is the 5th anniversary of the COVID-19 pandemic. Over 4,000 Rhode Islanders died over the last 5 years due to COVID. Nationally, 3,600 healthcare workers died providing care in the darkest moments of this pandemic. Many of you. Our union lost members on the care units because they weren't provided the PPE, the staffing, and the appropriate wages to be able to make it. And we're faced now with a brutal choice. Right now, the governor's proposed budget is to cut over $25 million from our state's hospitals, to gut safe staffing for our nursing homes, where the majority of people died from COVID-19, to underfund our federally qualified clinics that take care of over 100,000 Rhode Islanders in their primary care. We can't go back, can we? No! We need a budget that works for Rhode Islanders, that works for healthcare workers. Yes. What happened to the time 5 years ago when every house had a sign on the front lawn that said healthcare workers and essential workers were heroes? 5 years later, under the governor's proposed budget, he wants to cut money off of our backs, from our units, from our supplies, from our workplaces. Is that okay? No! Is that treating us like heroes? No! We are still dealing with poverty level wages. Yes. Isn't that correct? Yes! We're still dealing with understaffing. Yes! We're still dealing with for-profit or non-profits that act like for-profit, that take money away from the bedside to enrich the few.
Yes!
That is not where we should be 5 years after this pandemic.
No!
For many decades, Rhode Island underfunded Medicaid and the healthcare system. We cannot go back.
No!
We refuse to go back. Now I'm going to ask a few Frontline members to come up and say a few words about their experiences. Stefania, an RN from Greenville Nursing Home, is going to say a few words. Please welcome her.
Hi.
Hi.
No, I can hold it. Okay. My name's Stefania Silvestri, and 22 years ago I started my nursing career at Greenville Center in Smithfield. The starting wage there for a CNA was $9.50 an hour. This included medical benefits package for a full-time employee. You could survive as a single person on a CNA's wage at the time. The economy was also different. In 2002, the work environment was centralized on the residents' quality of life, therapeutic intervention, and adequate care. This environment was only possible because of the competent and fully staffed nursing and rehabilitation center. During this time, we would have, for example, 5 CNAs on each floor. We would have a nurse, a med tech, And an average floor, each floor would have an average of 8 to 10 patients per CNA. Then in 2019, I know it's hard to believe, in 2019 we were consistently short-staffed at my facility. That's why I decided to join the fight for short staffing. Sometimes there was one CNA to 12 to 15 patients. Guess what that is today, 5 years later? 12 CNAs, 12 residents for 15, one CNA. Clearly this does not provide any real quality of care. This diminishes the quality of life. Woo. Yeah, maybe hold this.
You got it.
I can't even do this.
You could.
Families would often express significant concern for their loved ones as patients were having trouble receiving the treatment they were placed in the facility for. The facility that I worked for changed owners and management many times over the last 22 years that I've been there. With each new owner, the standard of care became lower and lower, and the focus was often profit. The staff was stretched thin, burnt out, and underpaid. The facility was less concerned about the welfare of the residents and more concerned about the way residents' room looked. They would walk by the rooms to see if they had a bedspread on. That was more important. They didn't care if the resident hadn't had a meal or received their treatments on time, unless you were there overtime and you had to punch out late. In 22 years, Greenville has gone from a 5-star facility to a 1-star. A 1-star facility, as many of these for-profit facilities we've seen with short staffing have become 1-stars. Would you want your loved one in a facility that's a 1-star rating overall?
No!
Nursing has changed in the last 2 decades. With technology and new therapeutic interventions, what would have been a hospital stay can now be achieved in a rehabilitation center. Originally, this was thought to be a good thing for a patient. Now we care for cancer and chemo, trach patients, dialysis, obesity, diabetes, amputees, cardiac rehabilitation, antibiotic care, long-term treatments, so much more. Many of these patients are being sent to facilities without providing that higher level of support they need. Despite the increased ability of these facilities, the staffing levels never kept pace. Imagine for some of these residents, these are going to be the last months or years of their life. And it pains me to know that these residents deserved better, but we can't provide it because of the lack of resources provided by management. When the pandemic hit, we went from a low-level crisis to a full-blown catastrophe, and the bottom fell out. Once again, due to limited resources, the need outpaced the ability to care for patients, and many had suffered and died. Most of the pandemic COVID-19 patients were in nursing homes. I would be putting one patient on oxygen and the patient in the next room is on the floor, but I couldn't get to him yet. The resident down the hall has a fever of 103, and they're yelling in desperation, "Help me, help me." They're scared, they're alone, they're delirious. There's no one in sight. Nobody is coming to help them. I can't get to him either, and neither can anyone else. How? How can you save them all? How do you ease their pain and suffering? There's only 4 staff members at this time for 30 COVID patients. I placed body after body in a bag day after day. That smell of the plastic that still paralyzes me. These were residents I became close to over the years, and now I'm placing them in body bags. Every single day I sat in my car crying, then tried to compose myself by the time I drove home to my own family. It's heartbreaking, and I felt I couldn't do enough to save them. I tried to imagine how they felt. They were alone, and they were dying, and they knew they were dying. at the Greenville Center, all of the organized activities that gave our residents stimulation and the dignity of their life were gone. Instead of concerts and Christmas parties, holiday bazaars, and made-to-order breakfasts, our residents eat in their rooms or in a small dining room. They have little social, mental, or spiritual stimulation. How are we as a society okay with this? Imagine if it was your loved one stuck in their bed day after day with nothing to bring him or her joy. Imagine being treated like a task that you have to hurry up and get to the next one. Even with the increase in healthcare costs, this is still a familiar scene 5 years later. Throughout the state, I thought having our bill signed would bring this all to an end, but here we are 5 years later, asking for the same thing. We all know that safe staffing is shown in studies as the primary way to ensure quality care. Why can't we get that?
Yes. Yes.
Thank you. Thank you. In Governor McKee's proposed budget, he is to eliminate and reduce safe staffing law to make sure that nursing homes are not properly staffed. He has signed over 10 executive orders suspending safe staffing to prevent enough staff to care for individuals. We cannot afford a budget that takes us back to a time where we suffered and healthcare of our residents, healthcare of healthcare workers was put at risk. Next up, Nicole from Bannister.
Good evening. My name is Nicole Jean Gillis. I'm a registered nurse at Bannister Center for 18 years. I've been a nurse for over 30 years. I'm here today to remember our residents and co-workers 5 years since the pandemic. What was it like to work through the pandemic? It was characterized by stress, constant fear of infection, overwhelming patient loads, limited PPE, and a significance of critical ill patients and death. Healthcare workers were constantly exposed to the virus and potentially transmitted to our family members. Working long hours, spend less time with your family. Shortage of PPE like masks, gloves, gowns, did not have enough. That increased the risk of exposure. Staff shortage, example, on the unit with 52 residents, there were 2 nurses and 4 or 3 CNAs most of the time. No med tech. So when that happened, the nurse had to answer call light, assist resident to bathroom, and help feed the resident, which knocked the medication schedule. Training not good enough. We need ongoing training to keep up with the changing needs of our residents. Our patients need us. Their family would trusted us to make phone calls, video call for them. Could be the last one they see the loved one. Limited interaction with our co-workers and patients due to the isolation. During that time, we lost lots of co-workers and patients. What do we want as a healthcare worker during the pandemic? We were called healthcare heroes. We were called to act, adapt, and help save as many lives as possible. But we're still fighting for the same basic protection. We need better staffing, higher wages, and more training opportunity. We are calling on the governor and legislator to protect the staffing law and for us properly. Thank you.
Thank you. Next up, Dawn Williams from Butler Hospital.
If you don't mind. I don't mind. I have to get my glasses out too because I can't see everything. Just a little nervous. Good afternoon. My name is Dawn Williams. I'm a registered nurse at Butler Hospital. We are Rhode Island's leading mental health facility and provide a wide array of mental, behavioral health, and substance abuse services to adolescent, adult, and geriatric populations. Today we gather to honor the memory of all of those we lost during the COVID-19 pandemic. This day of remembrance is not only a tribute to the lives lost, but also a solemn reminder of the sacrifices made by healthcare workers who stood at the front lines during this unprecedented crisis. Our commitment, dedication, and tireless efforts saved countless lives and brought hope to many. Among the many healthcare heroes, the staff at Butler Hospital faced unique and profound challenges during the pandemic. The surge in mental health issues, compounded by the isolation and fear brought on by COVID-19, required extraordinary resilience and dedication. We provided critical support to patients grappling with anxiety, depression, and other mental health crises, often at a great personal loss. At the same time, we had to fight the hospital to implement proper infection control measures that aligned with our what? Congregate setting. I would like to share a brief account of my experience as a nurse at Butler Hospital during the COVID-19 pandemic. At the invitation of Mary Murphy Walsh, our 1199 organizer, I joined the Butler Hospital COVID-19 committee. Initially, I underestimated the severity of the situation, having previously experienced what I perceived as overreactions to similar public health concerns. I had no idea what I was getting myself into. In the many months that followed, I found myself carrying the fears and questions of 800 union members on my back and in my heart. I lost a lot of sleep and a lot of weight. I didn't mind that last part though. In the end, here's some things I learned. First, Butler Hospital and Care New England's priorities rarely align with the needs of their employees and often are not at the best interest of our patients. Second, the people who do the work are the ones that understand the work. And lastly, when we stand together, we are stronger. The work of healthcare heroes is far from over. The challenges we face today continue to demand our unwavering resolve and dedication. It is imperative that the state not only recognize, but also invests in the vital work that we do. Currently, the governor's budget proposes to cut hospital funding by almost $100 million, which would severely impact our ability to deliver quality care and support the health and well-being of our communities. We need the state to show its support and invest in the healthcare system that stands as a pillar of strength and hope for its people. We urge the state legislature to protect and increase funding for hospitals, acknowledging the ongoing contribution of healthcare workers and honor the memory of those we lost. It's not a question of finances, it's a question of moral obligation. Thank you for listening and giving me this opportunity to talk to you. Many people have gathered here today at our beautiful state capitol. Some are in celebration of women, some are in remembrance of the COVID-19 pandemic, some to talk to our state leaders, maybe to become leaders ourselves. I have hope today. As I leave, thank you very much and be well.
Thank you, Dawn. Last, we would like to invite Reverend Tracy to come say a few words of remembrance. We've lost a lot over the last 5 years. And one of the things that we cannot go back to is not recognizing the sacrifice of frontline essential workers in our economy, and to make sure that they do not have poverty level wages, that they have an affordable retirement, affordable health care for themselves, and staffing for their patients. And, Dawn hinted at it, but Butler Hospital had refused to provide PPE by claiming that they were not a congregate setting. And a lot like our nursing home members who worked without the appropriate PPE, we also had members in our federally qualified clinics that stayed open and worked during the darkest parts of our pandemic to provide primary care to everybody. And the governor's budget for hospitals, for nursing homes, for clinics, for essential workers takes us back to a time that puts us back at risk, and that is wrong. Reverend Tracy.
You're going to be able to hold that? Yeah, you're going to be able
I'm going to switch arms. I got to work
Okay, I'm sorry. Who wanted this win? Good afternoon, everyone. I am the Reverend Tracy Griffin. I serve as the Minister of Community Prayer for the Rhode Island State Council of Churches. I'm honored, for sure, to be with all of the essential workers here today. I would like to thank the 1199 SEIU Rhode Island and Raise the Bar on Residential Care for organizing this momentous event. As we know, on this day, March 11th, 2020, the World Health Organization declared COVID-19 a global pandemic, and all our lives were changed forever. We gather here today, 5 years later, to honor the lives lost, the lives of our loved ones, our friends, and our co-workers. For all those who became victims of the devastating COVID-19 outbreak that spread to pandemic levels in very short order. Let us remember the more than 1.2 million lives lost in the United States alone, and the more than 7 million worldwide. Please let us take a moment to prepare our hearts for a moment of silence to honor them. Amen. Today is not only the day of remembrance of lives lost, but a time to recognize and honor our essential healthcare workers, including the members of 1199 SEIU Rhode Island and Raise the Bar on Residential Care, who go to the mat every day to care and advocate for their patients. We also recognize the contributions of their support staff working within that healthcare system. We are all incredibly grateful to all our essentials workers who carried us through the darkest times of COVID-19 as they worked tirelessly caring for the sick and for the dying. I commend the entire healthcare workforce that never stopped going to work while the rest of us were in lockdown. They persevered through overwhelming patient loads in hospitals and nursing homes. They suffered through staffing shortages and gaining access to the much-needed PPE to protect themselves. They took incredible personal risk to their own health and safety, and their continued concerns about the safety of their families when they returned home from work. They dealt with the frustrated families who were locked out of hospitals and nursing homes at times when their loved ones needed them the most as they were dying. It was the nurses and the other essential care workers that held the hands of the dying and provided dignity and comfort for our loved ones so they did not have to die alone. As people of faith, we recognize the love and support of the essential workers that they provide to their patients. We support the efforts of 1199 SEIU Rhode Island and Raise the Bar on Resident Care for fair and just wages. We also support the need for sufficient funding for support staff to adequately care for the lives of others. Thank you all for your immense dedication.
So, before we disperse, I'm going to ask that if we have a few minutes as a group, we go inside. The Senate and the House are in session, and there's a balcony. There's a way to be seen by those people in session. One on the House side, one on the Senate side. And I'm going to ask us to walk slowly through there holding these signs so that they can see us as they make their decisions today. And we're going to need to keep coming back here en masse every day until this budget is done to make sure that the essential work that we do is properly funded and properly respected across the entirety of the healthcare spectrum.